The U.S. President Donald Trump has claimed he has total power to lift the nationwide coronavirus lockdown, contradicting state senators and legal experts.
The authority of the President of the United States having to do with the subject we're talking about is total.
Trump said that ultimately he can decide how and when to reopen the economy after weeks of social distancing guidelines. But governors from both parties are pushing back, noting they have the primary constitutional responsibility for ensuring public safety in their states. The Trump administration is looking at May 1st as a possible date for easing restrictions. New York Governor Andrew Cuomo responded to Trump's claim that states cannot do anything without his say-so and that he has total authority, saying governors have been left to figure out the crisis. He also called Donald Trump's behavior schizophrenic.
He didn't close down the economy. He left it to the governors individually to decide how to do it and when to do it and to convince their people to do it, by the way. I think was very, frankly, conservative in not getting engaged as a federal official. You're right. The states have to buy their supplies, figure it out. And now this is a 180. I have total authority. I'm going to tell the states what to do. So it makes no sense. It's schizophrenic. And this is even worse.
Now, Trump, of course, responded online, saying Cuomo had been calling him daily. He said that hospital beds and ventilators are the state's responsibility. But now that Trump got it all done, Cuomo, he says, seems to want independence. Let's go to Bob Herman, healthcare business reporter with Axios. He joined us now with a little bit more of a look at what is going on in the U.S. Thanks for joining us today.
Thanks for having me.
So Trump had a bit of a skirmish yesterday during that briefing with reporters because he's being pushed on whether or not he acted quickly enough to what was a pandemic. What is your take on his, first of all, response?
Yeah, so he said that he has total authority to kind of lift the lockdowns. And I think most legal experts would say that he does not. The 10th Amendment to the U.S. Constitution more or less says any powers that are not reserved for the federal government are reserved for the states. And in a situation like this, it seems like the states would indeed have those powers in a public health crisis. So to say that he has total authority to, lift restrictions seems constitutionally dubious at best.
And he has left it to the governors across the country to make their own decisions a lot of times, because some put in restrictions early on and some decided to go with them much later, if at all.
Right. And we're actually seeing states take more of a handle now. Just yesterday, we saw that two groups of states here in the U.S. are working on regional plans to lift their lockdowns. One group, and these are all Democratic states, one group is in the East, which includes New York, New Jersey, Massachusetts, and then there's a Western group as well with California, Oregon, and Washington. So states they're banding together now to kind of decide when they should lift lockdowns. They're already not necessarily looking to the federal government to decide that, but there's still an important for the federal government to play in terms of dishing out supplies and overall messaging, because it appears social distancing is working, and it's it's an important part of messaging for the federal government to be saying this is working. We should not necessarily let up.
I was going to say, what do the governors rely on from either the task force, from the White House? Messaging is clear, and then I guess the backup of supplies. Anything else?
Yeah, well, messaging is important because citizens are still looking to Trump and his task force for any kind of signs of when things will lift up. But just as importantly is this national stockpile that includes ventilators, masks, any other supplies that are needed on the ground at hospitals. Those are the two main areas where the federal government has been helping, and those are two areas where they kind of need to keep going. And on the messaging front, we've even seen this from the U.S. Surgeon General saying, I don't necessarily think that things are going to reopen on May 1st. It's probably going to leach into May as well. So there's a lot of contradictory messages, and the federal government, they're still very important in this. The states necessarily still can't do everything themselves.
So, Bob, let me ask you about supplies, because the way Donald Trump presents it during those press conferences is that the states are lucky to have some federal help. Is the federal government mandated to help the states at a crisis time like this, or are they sort of up to whatever the White House decides and how generous it wants to be there?
Well, I mean, for these types of public health crises, the federal government has a role to play, which is to help out states in times of need. And specifically with this, the federal stockpile is created for these types of disasters that you see it being used for hurricanes and other natural disasters. The same obviously applies for a pandemic like this. States can't necessarily do everything themselves because they don't have the resources to do everything. And the federal government has the ultimate responsibility to play the role as messenger and supplier. And the national stockpile in particular was created for these very purposes.